Pudendal neuralgia and pelvic floor dysfunction. What are the similarities? What are the differences? That's what this video is all about. Pelvic floor dysfunction is as a result of pelvic instability. Pelvic floor dysfunction is the name of a book with many chapters. Pudendal neuralgia is one of them. So what's the difference? One is bigger than the other. One involves a lot more than just the irritation of a pudendal nerve. So let me explain to you a little bit more in detail, and then you'll see. Your pelvis is the foundation to the structure above. It has your lower extremities attached to it. So it's impacted by the performance of the lower extremities. It's impacted by the performance of the structure above. It is frankly impacted by the bones that make it up. So there are 3 joints that are just the pelvis, and then you've got the spine attached, so that makes it 4. Then you've got the 2 hips, which makes it 5 and 6. When your pelvic stability is compromised, so your pelvis tilts down or up, or oscillates back and forth, or rotates, or side shifts, it's unstable. The muscles on the inside of your pelvis have to behave differently. The outside environment's not stable. The inside has to make up for it. Why? Because without a strong base, the structure above is in jeopardy. This is a set space, and it's lined by the muscles. It's not just the floor. It has walls that work their way into the floor. There are certain residents that sit here. So those are your arteries, veins, nerves, muscles, joints, ligaments. Then there is bladder, intestine. If you're a male, prostate. If you're a female, it's ovaries and uterus. Of course, there are tubes that come to these structures and tubes that get bowel or stool or urine out. So all of these are at jeopardy when this space becomes smaller. So when we go on the inside, we go through the vagina or we go through the anus and we try to relax those, how far do you think that's going to go on the inside? How sustainable is that, is the question we want to ask. If I go in and I do a nerve block to block the pudendal nerve, which exits from your spine, in fact, from the back of your pelvis, this yellow thing that you see here, that's your pudendal nerve, which goes through this tortuous path on the inside to come out to the vagina or penis, to the perineum, which is right behind it, and to the anal area. So anything along this path, and that's the sensation, it's the motor function of the pudendal nerve is the sphincter control. So it can show up as sphincter control, it can show up as sensation that you're having, but there are other things that can happen also that give you the different sensation and different pain, stabbing, you know, with this it's stabbing, sometimes it's stabbing pain, sometimes it's burning pain, but bottom line, you can have groin pain, you can have a bunch of different things that come as a result of pelvic floor dysfunction. So what we need to do is not to go after Botox to relax the muscle, because after all, the opposite of tension is not paralysis. It's relaxation. When we go in and we block the nerve, what are we doing? Did we solve why that nerve became irritated to begin with? When we start removing body parts, like tailbone as an example, that's another thing that's I'm seeing a lot more of. Then we're going overboard. So what we need to do is we need to stabilize the pelvis, to remove the reason why the residents, including your pudendal nerves, being irritated. How do we do that? We do it using developmental exercises. This is the same things you and I and every walking human being on the planet Earth has done to get themselves from that helpless infant stage to become running toddler. Once you learn how that's done, you apply those principles across all your activities, including your workouts. It's kind of like driving a car. Once you learn how to drive, you can drive it here or in Timbuktu. You can drive it when it's a snowy day or it's a beautiful sunny day. It doesn't matter. You learn how to. Keep chasing the why until you get to the root cause. Then you address the root cause and anything else that feeds the root cause. If you need help with this path, contact me. I think I can help you. Thanks for watching.